Intracytoplasmic sperm injection, ICSI. Indications, procedures, and outcomes. Intracytoplasmic sperm injection, ICSI, is a specialized technique used in vitro fertilization, IVF, to treat male infertility issues. It involves the direct injection of a single sperm into the egg using a microneedle. ICSI is often used in cases of male infertility where sperm quality or quantity is compromised, and it can dramatically improve the chances of successful fertilization and pregnancy. Here's a detailed overview of ICSI, including its indications, procedure, and outcomes. 1. Indications for ICSI. ICSI is specifically designed to address male infertility issues, especially those that make conventional fertilization, where sperm is placed with eggs and fertilization occurs naturally, difficult or impossible. ICSI is typically recommended when a. Male factor infertility, severe oligospermia, low sperm count, less than 1 million sperm per milliliter. Azoospermia, absence of sperm in the ejaculate. This may be caused by obstructive azoospermia, blockages in the reproductive tract, or non-obstructive azoospermia, problems with sperm production. Treatment. In cases of non-obstructive azoospermia, sperm may be retrieved directly from the testicles or epididymis through a procedure called TESE, testicular sperm extraction, or TESA, testicular sperm aspiration. Poor sperm motility, asthenospermia, when sperm have low motility, making it difficult for them to reach and fertilize the egg. Abnormal sperm morphology, teratospermia, when the sperm have abnormal shape, which can impair the ability to fertilize the egg. Previous IVF failures. If conventional IVF has previously failed due to male infertility factors, ICSI may be considered as a solution. B. Other male reproductive issues. Ejaculatory problems. Men with issues such as retrograde ejaculation, where sperm enters the bladder instead of the urethra, may require sperm retrieval methods like PESA, percutaneous epididymal sperm aspiration. Low sperm quality. ICSI is helpful when sperm quality is suboptimal, making traditional insemination in IVF difficult. Genetic conditions. In some cases of male infertility caused by genetic conditions, such as Klinefelter syndrome or Y chromosome microdeletion, ICSI can help by injecting the sperm directly into the egg. C. Fertility preservation. ICSI is often used in conjunction with sperm banking for men who wish to preserve fertility before undergoing treatments such as chemotherapy, radiation, or surgery. 2. Procedure of ICSI. The ICSI procedure is generally performed as part of an IVF cycle. The process can be broken down into several key steps. A. Ovarian stimulation. The woman undergoes ovarian stimulation, typically using FSH, follicle stimulating hormone, and or HMG, human menopausal gonadotropin, to stimulate her ovaries to produce multiple eggs. The development of the follicles is monitored through ultrasound and blood tests to track the levels of estradiol. B. Egg retrieval, oocyte aspiration. Once the eggs are mature, HCG, human chorionic gonadotropin, is administered to trigger final egg maturation, and egg retrieval aspiration is performed under sedation or general anesthesia. The eggs are collected using a needle that is inserted through the vaginal wall and into the ovaries under ultrasound guidance. C. Sperm collection. Sperm is collected from the male partner via masturbation, or if sperm count is very low or absent, sperm retrieval methods such as T-ESA, P-ESA, or M-ESA, microsurgical epididymal sperm aspiration, can be used to extract sperm directly from the testicles or epididymis. The sperm is then processed in the laboratory to select the best sperm for injection. D. Sperm injection. ICSI is performed by a highly skilled embryologist who uses a microneedle to pick up a single sperm and inject it directly into the cytoplasm of the egg. The procedure requires precise handling of both the sperm and the egg and is typically performed under a microscope. After the sperm is injected into the egg is incubated and monitored for fertilization. E. Embryo culture. The fertilized eggs are cultured in an incubator and monitored over the next few days. Most embryos are cultured for 3 to 5 days to the blastocyst stage before being transferred. High-quality embryos are selected for transfer, and any remaining embryos can be frozen for future use. Embryo cryopreservation. F. Embryo transfer. After 3 to 5 days of culture, the best quality embryos are selected for transfer into the woman's uterus. The transfer is done using a catheter inserted through the cervix, and no anesthesia is required. The woman is given progesterone supplements to support the uterine lining and aid in implantation. 3. Outcomes of ICSI. The outcome of an ICSI procedure depends on several factors, including the woman's age, the quality of the sperm and eggs, and the overall health of both partners. A. Fertilization rate. The fertilization rate for ICSI is typically 70 to 80%, much higher than traditional IVF, as it bypasses the need for sperm to penetrate the egg on its own. Even with male infertility factors, sperm can still fertilize the egg, increasing the chances of success. B. Pregnancy rates. The pregnancy rates following ICSI are comparable to conventional IVF and generally depend on factors such as maternal age and egg quality. Success rates for ICSI are generally 40 to 45% per cycle for women under 35, but rates decrease as maternal age increases. C. Risk of birth defects. Some studies have suggested a slightly higher risk of birth defects in babies born through ICSI compared to naturally conceived pregnancies, although the increase is small. The risk is primarily related to genetic factors that contributed to the male infertility in the first place, not the ICSI procedure itself. D. Long-term outcomes. Research has shown that ICSI pregnancies generally have similar long-term outcomes to naturally conceived pregnancies. However, some concerns regarding the potential impact of genetic conditions inherited through male infertility have been raised. ICS. I may be used for both traditional IVF cycles and those with egg donation or frozen eggs. E. Emotional and psychological outcomes. IVF and ICS. I can be emotionally and financially challenging for couples. It is important for individuals to receive emotional support, especially if the IVF cycle is unsuccessful or if it takes multiple attempts. Counseling and support groups are often recommended to help patients navigate the IVF journey. 4. Conclusion. ICSI has proven to be a revolutionary technique in the treatment of male infertility, providing an option for men with severe sperm-related issues to father children. The procedure is highly effective, with high fertilization rates and a substantial chance of pregnancy. However, it is important to understand the potential risks and limitations, including possible genetic factors influencing IVF outcomes and the higher costs involved in the process.